Just 2 ingredients. They work when we're over 60, often when most medications fail. Both are probably in your kitchen right now. And when you combine them, your body does something most doctors don't talk about. But there's one small detail that decides whether this works or does absolutely nothing. Most people get that part wrong. I'm talking about raw honey and rosemary. And before you dismiss this, before you think, oh my God, another home remedy video, just hear me out. Because what I found in my research really surprised me. Here's why this combo is different from using either one alone. Honey helps pull out and carry rosemary's key compounds, things like carnosic acid and rosmarinic acid, so your body actually absorbs what matters. In a minute, I'll show you the exact method. But first, you need to see what this does. Number 19. Memory loss and brain fog. This is the big one. And the research here is not old. This is brand new. In early 2025, researchers at Scripps Research Institute developed a stable form of carnosic acid, that's the main active compound in rosemary, and tested it on mice with Alzheimer's disease. After 3 months of treatment, these mice showed improved memory across multiple tests. Their brains had more synapses, more connections between nerve cells, and the proteins associated with Alzheimer's, the amyloid beta plaques and the tau tangles, were reduced. But here's the part that really got me. This compound only activates in areas of the brain that are inflamed. It's like a smart drug. It goes where the damage is and ignores healthy tissue. Now, a separate study, this one used an accelerated aging mouse model, found that rosemary extract with 60% carnosic acid improved learning and memory after just 90 days. 90 days. And when they looked at the brain tissue, oxidative damage markers were significantly reduced. And honey? A review published in PMC found a direct correlation between honey's antioxidant content and neuronal cell protection. The darker the honey, the more antioxidants, the more brain protection. So you've got rosemary protecting the brain from inflammation, and honey protects it from oxidative damage. 2 different pathways, 1 spoonful. Number 18, joint pain and stiffness. If your knees hate the mornings as much as mine do, this one matters. Rosemary contains compounds that interrupt the same inflammatory pathways that drugs like ibuprofen target. Rosmarinic acid inhibits COX and LOX enzymes. Those are the enzymes that tell your body to swell up and stay swollen. But unlike ibuprofen, it doesn't tear up your stomach lining in the process. And honey's flavonoids, specifically chrysin and something called CAPE, they suppress a protein called NF-κB. That's the master switch for inflammation in your body. When NF-κB is active, your joints hurt. When it's suppressed, the swelling calms down. 2 ingredients, 2 completely different anti-inflammatory mechanisms, both working at the same time. Number 17. High blood pressure. Okay, so this one surprised me. Researchers at the University of Massachusetts discovered that rosemary works as a natural ACE inhibitor. ACE inhibitors are one of the most commonly prescribed classes of blood pressure medication. They block the formation of a hormone called angiotensin II, which constricts your blood vessels and pushes your pressure up. Rosemary does something similar, naturally. Other studies show rosmarinic acid helps blood vessels relax and dilate. More relaxation, better flow, lower pressure. Quick note here though, and I mean this, if you're on blood pressure medication, talk to your doctor before adding rosemary to your routine, because stacking a natural ACE inhibitor on top of a pharmaceutical one could push things too low. That's not a scare tactic. That's just being smart about it. Number 16. Poor circulation. This connects directly to what I just said. When rosemary opens up your blood vessels, blood flows more efficiently. More oxygen reaches your tissues. Your hands and feet stop being cold all the time. That numbness and tingling that creeps in? Circulation is almost always part of the story. There's actually a historical piece to this that's kind of fascinating. In the 1500s, Queen Isabella of Hungary was given a rosemary-based preparation by a hermit for her age-related rheumatic problems. It became known as the first distilled perfume in European history. They called it the Queen of Hungary's water, and it was used specifically for circulation. 500 years later, science is basically confirming the hermit was right. Number 15. Chronic low-grade inflammation. Now, this is different from the joint pain I mentioned earlier. This is the silent kind, the kind you can't feel. After 60, most people have what's called chronic low-grade inflammation happening throughout their body. It doesn't hurt, there's no swelling you can see, but it's quietly driving heart disease, diabetes, cancer, and brain degeneration. Carnosic acid from rosemary activates something called the NRF2 pathway. Think of NRF2 as a switch inside your cells that turns on your body's own anti-inflammatory defense system. When that switch is flipped, your cells start producing their own protective enzymes. And honey? A comprehensive review of 48 clinical trials found that honey reduces cardiovascular and metabolic risk factors. Its polyphenols, there are over 30 different types identified, act as antioxidants at the cellular level. So you're fighting inflammation from the outside in and the inside out, simultaneously. Number 14. Weak immune system. After 60, your thymus gland, that's the training camp for your immune cells, starts shrinking. Your white blood cell production slows down. You catch things easier and you recover slower. Honey stimulates the proliferation of both B lymphocytes and T lymphocytes. Those are the soldiers and the strategists of your immune system. It also activates phagocytes, the cells that literally eat bacteria. Rosemary brings antibacterial, antiviral, and antifungal properties through carnosic acid and rosmarinic acid. The FDA has actually labeled rosemary extracts as generally recognized as safe. So honey wakes up the army. Rosemary gives it weapons. Number 13. Respiratory problems. Colds, coughs, bronchitis, that chest congestion that hangs around for weeks. This is actually one of the oldest traditional uses of this combination. In Mediterranean cultures, rosemary-infused honey has been used as a winter tonic for generations, and Mayo Clinic research confirms honey is an effective cough suppressant. Rosemary honey specifically has antiseptic and balsamic properties that target the respiratory tract. It warms and opens the airways. Think of it as nature's chest rub, but from the inside. Number 12. Digestive issues. Bloating, gas, that heavy feeling after meals. Carnosic acid, same compound protecting your brain, also balances your gut bacteria. Rosemary stimulates bile production, which is essential for breaking down fats. And honey's prebiotic effect feeds the good bacteria in your gut, which then produce short-chain fatty acids that reduce intestinal inflammation. 1 tablespoon of rosemary honey after a meal. That's the traditional Mediterranean approach. And there's a reason it survived for centuries. Number 11. Blood sugar spikes. This one's interesting because rosemary actually mimics a class of diabetes medication. It works as an alpha-glucosidase inhibitor, which slows down carbohydrate absorption from your intestine. The result is a gentler, slower rise in blood sugar after meals. Studies on diabetic animal models showed rosemary extract not only improved glucose levels, but also helped protect against diabetic nerve damage. And honey, despite being sweet, has a lower glycemic index than refined sugar. When it replaces other sweeteners, studies show better glucose tolerance overall. Again, if you take diabetes medication, check with your doctor. Natural blood sugar lowering plus medication could cause a drop you don't want. Number 10. Poor sleep quality. A 2020 study tested rosemary extract on men with mood disturbances and found it improved both mental energy during the day and sleep quality at night. That sounds contradictory, but it makes sense. Rosemary helps regulate your stress hormones. When cortisol drops, melatonin rises. You sleep better. And honey? It promotes tryptophan transport to your brain. Tryptophan converts to serotonin, which converts to melatonin. 1 teaspoon of rosemary honey before bed gives your brain the raw materials for its own sleep chemistry. Number 9. Anxiety and stress. A randomized trial found rosemary supplements significantly lowered anxiety levels compared to placebo. Industrial workers who drank rosemary tea daily reported less burnout. And here's something most people don't know. Rosemary honey naturally contains lithium. Lithium, the same element used in psychiatric medication for mood disorders. Obviously, we're talking about trace amounts. Nobody's replacing their medication with honey. But the fact that it's even present is remarkable. Number 8. Skin aging, wrinkles, dryness, age spots. Rosemary extract has been shown to protect against UV radiation damage, one of the primary drivers of skin aging. A study from 1999 tested a rosemary honey cream and found significant moisturizing and emollient power. And honey? It's been used in wound dressings, burn treatments, and skin repair across dozens of clinical trials. The antioxidants in both ingredients neutralize free radicals, those unstable molecules that break down collagen and accelerate aging. Number 7. Hair thinning and loss. A 2025 clinical trial found rosemary oil blends significantly increased hair density and reduced hair fall. Earlier research showed rosemary was as effective as minoxidil, the active ingredient in Rogaine, for increasing hair count. The mechanism is improved scalp circulation plus reduced follicle inflammation. Rosemary honey used as a scalp treatment adds antimicrobial action that fights dandruff and keeps follicles clean. Number 6. Liver health. Your liver is your body's filter, and after 60 years of filtering, it needs support. Rosemary honey is specifically indicated for hepatic support. That's documented in Mediterranean traditional medicine and backed by animal studies showing rosemary protects the liver from oxidative damage. It also helps regulate uric acid levels. Number 5. Slow wound healing. A 2024 systematic review published in PMC identified medical-grade honey as the most potent wound care product for elderly patients. More effective than silver dressings. More effective than enzymatic products. Honey accelerates healing in burns, diabetic foot wounds, pressure sores, and ulcers. Add rosemary's antimicrobial properties, and you've got a wound treatment that heals and protects simultaneously. Number 4. Eye health. Okay, this one. Nobody expects this. Rosmarinic acid has been shown to delay the onset of cataracts and reduce the severity of age-related macular degeneration. The antioxidants shield delicate eye tissue from oxidative damage. Most people think of carrots for eye health. Almost nobody thinks of rosemary. Number 3. Allergies and sinus problems. Japanese researchers found that daily rosmarinic acid prevented allergic asthma triggered by house dust mites in animal studies. It also inhibits seasonal allergic rhinitis, hay fever. And unlike antihistamines, which suppress your entire immune response, rosmarinic acid selectively targets the overreacting immune cells while leaving the healthy ones alone. Honey, especially local honey, has long been used anecdotally for seasonal allergy support. Combined with rosemary's targeted action, this is a 1-2 punch for allergy sufferers. Number 2. Depression and low mood. I mentioned the lithium content earlier, but there's more. A 2020 review found rosemary has antidepressant effects by regulating dopamine through specific brain pathways. It enhances neurogenesis, the growth of new brain cells. And rosemary honey has been traditionally used for senile dementia, depression, and mood disorders across multiple Mediterranean cultures. This isn't a replacement for professional mental health care, but it's a nutrient-dense addition that your brain chemistry may genuinely benefit from. And number 1, muscle pain and cramps. Rosemary has antispasmodic properties. It relaxes smooth muscle and reduces cramping. Research published in the European Review of Medical and Pharmacological Sciences found rosemary essential oil helped manage pain alongside standard analgesics. The active compounds, camphor, alpha-pinene, and cineol, work on the muscle fibers directly. For anyone dealing with nighttime leg cramps or general muscle soreness after 60, this is practical relief. Now, let me tell you exactly how to make this. There are 3 ways. Method 1, the quick version. Warm a cup of raw honey gently. Never boil it. Heat destroys the enzymes. Add 2 tablespoons of fresh chopped rosemary leaves. Stir. Let it sit for 30 minutes. Strain if you want, or leave the leaves in. Done. Method 2, the potent version. Pack a glass jar about 3/4 full with fresh rosemary leaves. Pour raw honey over the top until the leaves are completely covered. Seal it. Store it in a cool, dark place for 4 to 8 weeks. The longer it sits, the stronger the extraction. This is the traditional Mediterranean method. Method 3, the daily version. Brew rosemary tea. 1 teaspoon of dried rosemary in hot water. Steep for 10 minutes. Add a spoonful of raw honey after it cools slightly. Drink 1 to 3 cups a day. But here's what matters, and most people get this wrong. The honey must be raw, not pasteurized. Pasteurization destroys the enzymes and most of the beneficial compounds. If the label doesn't say raw, skip it. The rosemary should be fresh when possible. Dried works, but fresh contains more volatile oils. And always store in glass, never plastic. Honey is slightly acidic and can pull chemicals from plastic containers over time. Before you go, quick note, everything here is based on published research, but your body and your medical history are unique. If you're on medication, especially for blood pressure, blood sugar, or blood clotting, talk to your doctor before trying this. This isn't about replacing treatment. It's about adding one more tool. Now tell me in the comments, which of the 19 surprised you most? Chances are, someone else needs that answer too. And if you want the next step, click the video on your screen. I'll meet you there.